Hello everybody. I've seen a lot of videos on YouTube lately. People showing their bags and trauma bags and preparedness videos, stuff like that. I thought I'd show you mine. A little history on me. I have a 20 years background in EMS. I've been a paramedic for about 20 years, firefighter for about 20 years as well. I also teach first responder, EMR, first aid for over 12, 14 years, something like that. And over the years, I came to make bags. I have a couple of them for when I teach. I have 3 trauma bags. They're not the same as this one. A couple oxygen tanks, kids, and backboards and stuff like that. But this is my personal bag. This is the one I bring with me when I teach in case something happens, or in the back of my car when I go on trips or I'm traveling around the province. This is a Kemp USA bag. I really like the Kemp design. It's the old school kind of bag. It's not the backpack, and since it just stays in the back of my truck, it's perfectly fine for me. Right on the top, you can see got some gloves, BSI. If you get somewhere, you have gloves right away. The way it's designed, this bag, is I do have some medicines in the front, but I don't have it stuffed with bandages like most people do. Some people have them stuffed with bandages. And the thing about bandages is you don't need as much as what most people say. A couple of abdominal pads usually stops any kind of bleeding in my 20 years experience. And the ones that are really bad, like legs almost cut off or anything like that, you put a tourniquet and it stops. So I have it set up more like tools for other kind of things. So when you get into the bag, I open up the main compartment. Right on the top, I have my vital signs. Vital signs, I have a BGL monitor, check the sugar. I have a SpO2 meter, some pen and paper, stethoscope, and a blood pressure cuff, and that old one. And yeah, I did cut myself a while ago, and I had to use my bag just a while ago up here. Other things I have in my bag is I have a lot of gloves for BSI, some alcohol for washing your hands in the bottom here somewhere, or on the other side. There we go. So I have some alcohol, and right here I have some glasses for eye protections, vomits. I have some CPR stuff, a couple of extra pads to go with my AED. I have a sharps container if I use any needles, BVM, and I do use a Physio Control CR Plus AED. This is what I got. I know not everybody puts one of these in their bags, but I do a lot of teaching, a lot of places, and I kind of have bad luck in my last 20 years, so I have a nice AED with me at all times, just in case. I use a Physio Control Life Pack. I'm not selling or marketing this. It's just I believe in the 360 joules compared to other models that are out there that give 150 in that. Sometimes you need the extra joules, and I like to have the 360 biphasic joules. And it talks very well and has a very good guarantee on it as well. Our fire service time here, we just bought one just like this again. Just put it in service last week in our other fire truck, our new fire truck. So, you know, we have, I highly recommend these ones. I don't sell them. Sorry about the marketing. So our bandages. Bandages we have here. I always have my 4 triangular bandages, ace bandage, and a nice big compression bandage. Fits perfectly well right here. That's all I need for some bandaging. On this side here, I have a couple abdominal pads, 2 or 3 abdominal pads, a few 4x4s, and some cling. That's it. There's tape in the bag in the front. And when you get to the front of the bag, here, we have some OPAs, a couple of tongue depressors, some more pens, pen light, you know. I have aspirin. Everybody should have aspirin in their bags. I have some glucose pills, nitro, Venolin. I have some NPAs. I have a seatbelt cutter. I got some aluminum foil space blanket, and some scissors, and some 2 tourniquets. You get these tourniquets online, you know, cap tourniquets are pretty cool, work well. I also have some cheat cards. I find these are really good, like the PD wheel. Kind of gives you it goes by size or age, gives you the weights, gives you the vital signs for the child. Also get an APGAR score in the back, and your medications you can give too. It's already pre-measured for you, which is pretty cool if you're giving some medications. I also have a couple of cheat sheets. I made these myself. You just go online, find a pattern, or write them yourself. Just basically your primary survey, secondary survey, questions asked, vital signs, OPQRST for pain, different types of shock, and your Glasgow Coma Scale, which is pretty cool for, you know, when you have to call 911 or if you're talking to your dispatch, you can give them more of a heads up of how your patient's doing. I made these not primarily for me to remember, which is good for my memory too, with these things, But if you get to a scene or some firefighters, you can kind of give the card to them and say, go check on the other guys, and they have something with them. It's pretty cool to have, and it gives you a reminder too if you guys are not used to using these. When I teach, I put these in the teaching bags and make sure that people have a good foundation of how they're doing their course. It gives them confidence that they have what they need in the bag. Some band-aids, and that's pretty much it. Now on the top I have a SAM splint that goes across the top right here, and goes with trailer bandages if I do need to give a splint. And that's pretty much all I keep in my bag. And I find it set up pretty good. Oh, just before I forget, also, I do have an opiate kit. These are no longer need a prescription in Canada to get them. You just go to your pharmacy, you ask for it, give them a reason for it. Sometimes you can take a little course depending where you are and how to use these. Most first aid courses now they'll show you how to use this to give you an idea. There is the nasal spray, which is very well. I have the needle injection just because I got this before the nasal spray. So instead of investing $150 in a nasal spray, I'm going to keep this one. It's good for 3 years. And then after 3 years, I'll just swap it out. And that's pretty much it for my bag. If you have any questions or anything like that, just give me up with a comment or something like that. And if you want me to show any other kind of different bags or anything like that, let me know. And that'll be it. Thank you.